years ago, I found myself in the emergency room. I thought that I was absolutely about to have a heart attack.
I was like opening doors for interviews because now Amy was like one of the first magazines to be running in the country when we started. We can journey through this together because no one arrives. We just come to a place of mastery, and then there's always something else in our life that we're working on, and so we don't.
So Queen, you have the power. You have the power to decide that you want to live a different life. Welcome back to Empowering Queens TV. Empowering Queens TV is a platform to help women become more confident and to claim what's rightfully theirs. I'm Duquesa, your host, and I'm privileged to continue this conversation with two amazing women. They are...
Hi, I'm Patrice Lockhart, and I'm CEO of Shaddai Health. And at Shaddai Health, our passion is just to help people achieve the good health goals. And we do that through our products, our services, and education. And as a result of what we do, it makes my life so much better to say that so many persons have been experiencing an upgrade in their health.
Awesome.
And I'm Dr. Gertrude Holder, practicing family physician here in New Providence, and I'm committed to providing comprehensive family medical care.
Awesome. I mean, it's certainly a privilege to be here with you, dynamic ladies who are making a difference in the healthcare industry for so many people. In our previous episode, we started to talk about some of the diseases that we look at and their symptom lists for the untrained eye.
Mm-hmm.
We have silent diseases like high blood pressure, like diabetes. We have silent diseases like heart disease that we know exist, but because we don't know the symptoms so well, or they're symptoms that we can explain away, we don't give it the type of attention that we really should so that we can live healthy, wholesome lives. As a physician, Dr. Holder, how do we treat these chronic diseases? What are some of the methods that we use from traditional medication or traditional methods to treat people with these sorts of diseases?
Well, we know that a lot of these diseases are sometimes termed lifestyle diseases. Okay, so first things first, change your lifestyle.
Yes.
Okay, number one, right? The other thing is there are always medications that are available. The drug industry is loaded with them.
Yes.
They are.
They are.
No time.
Yes. And the classes of medications for high blood pressure and diabetes is vast. There's several different classes that you can use depending on the patient in front of you. And that's the thing. You have to individualize care for each and every one of your patients. But I want to stress lifestyle because I think that a lot of patients ignore that or ignore the impact that a lifestyle change can have on chronic illness. Okay?
Now, I'll be the first to say that it sounds easy.
Mm-hmm.
Lifestyle change sounds easy.
Mm-hmm.
But here are some facts. From we were born, we were plied with sugar. We're given birthday cake with icing. Icing is lard and confection sugar, or it may be sugar boil on the stove top with eggs or whatever, right? But our palates have been conditioned to eat sugar. We're given sugary beverages like sodas and Gatorade and under the guise of healthiness, right?
Hopefully they'll be banned soon.
Yes, right?
And then we give our kids treats.
I did a research on Milo. A lot of children drink Milo, but Milo is just full of sugar. Apart from sugar, we've been conditioned to eat rice, macaroni, plantain, coleslaw, potato salad, all in one meal on a Sunday with two meat.
Don't forget that.
And so we've been trained from little children when we send kids to school, potato chips, cookies, juice. Other little treats and juice, very little water, very little fruit, right? So our palates and our mindsets have been trained to eat a particular way. In addition to what we have been trained to eat, because we eat what we're given, and so that's what we choose from. That's just reality. we live lives that are not as active as our parents did.
Exactly.
So back in the day, our parents went farming.
Mhm.
Our
They
parents
walked
walked from
everywhere.
settlement to settlement, or they
Mhm.
walked from home to downtown.
Mhm.
Correct.
We use cars. We're not outside playing marbles or jacks anymore.
Mm-mm.
We're on technology on our phones, so we're
Yes.
sitting down a lot. So lifestyle change is necessary.
Mhm.
It's. I'm going to be honest. It's not easy. How do we get people to begin those small incremental steps towards changing lifestyle? And women in particular, because we've already agreed
Mhm.
in our previous episode that we put ourselves last. How do we make ourselves priority and begin to incorporate some of those changes? And not just for ourselves, but we feed our families, as you
Mhm.
alluded to in
Yes.
our
Mhm.
earlier segment. So what are some of the steps that we can take as women?
One of the things I'm big on information and knowledge. Scripture tells us that my people perish for lack of knowledge. The more you know, the more you are empowered. One of the things I began in the last session to say that was very powerful for me, I did a session in one of the islands with not just the mothers, but the daughters. And you know who were the driving forces? The daughters. The reports I got back, what I did was I did a session on genetically modified foods. I did all of the facts, all of the data behind it, what it was. Then I dealt with also the dangers of hidden toxins found in foods we're eating. And I did the top ones that on a daily basis, what we are eating, what we're encountering unaware. And I used all the data, etc., and the research and whatnot to back it up. And I got mothers coming back to me and saying, do you know what you did to my child? My children, they're cleaning out the cupboards. They are saying no, they have been doing their own research and whatnot. I find that adults are the hardest ones to break habits.
Yes.
And in fact, my former pastor, Pastor Miles, who said anytime God wanted to do something new, he had to send a baby. He started with a baby.
Wow.
And so I think even if adults are finding it hard for themselves, think about your children. One of the saddest things for me was I had a 23-year-old young girl stand in front of me, a Bahamian girl, beautiful young lady, well made up, whatnot. That young lady had colon cancer. And it was so bad that when they went to the doctors, when the doctor was finished with her, she went out and the doctor spoke to her mom. She couldn't deal with it. And I've had an opportunity to meet a lot of persons like that, young persons. And so what it has done for me, I love my older people, but what I'm now trying to do is with the younger persons as well, creating an awareness so that they too, not just the older ones, the younger ones as well. So for me, it's been creating an awareness constantly, and until it gets into the subconscious somehow, somewhere.
Now I'll tell you, when you came to our cancer support group and you did your presentation and you provided the data, it was a no-brainer for me. That's when I started to make changes, because previously I played with natural stuff. I'd order natural food, I'd eat vegan food, I toyed with it a bit, but it wasn't until I saw the research that demonstrated what's inside food, the quality of food that we get, even right down to the pots that we use, the plates, the plastic, all of that. I was overwhelmed by the information and the support that you gave for the information. And so it's because of that our support group has started the journey of transitioning from some of those foods where we no longer use plastic, and so we're using either paper or people are now coming and bringing their plates. So when they come for the refreshment. So we started small incremental steps, and I believe that that's the important message that we send. That change doesn't happen
overnight.
All at once.
It's definitely a process.
Yes, and so if we can take incremental steps towards the goal of becoming healthy, people may stick with it a little bit longer.
Yes, right? That's very important.
Yes, and you said something about coming to the support group, support is important.
Yes, it is.
So if you
Yes.
feel you can do something along with somebody else, you know,
Yes.
you have the accountability factor with
Mhm.
that.
Mhm.
Okay, and you know you're more likely to continue with something
That's
once you
yes.
know that
You've got the support.
you have the support.
Yes.
Absolutely.
Yes.
We have a 21-day healthy habit challenge we do every year. And with the 21-day, we have Dr. Nishkam Bristol. She's a consultant physician. Then we have a health food chef that helps prepare foods for persons. Then we have a coach. We put these group of persons across the Bahamas. They're in this WhatsApp group, and we have a coach that works with them every day.
Mhm.
Every day. And Dr. Bristol, she analyzes every one of our clients so that we know who's going to have a sugar withdrawal at what point because of their food intake and whatnot. And that support, so many persons have said it's because they had the support every
Yes.
day, every
Yes.
step of the way.
Yes.
Yeah.
And that's so true. Because I did a 21-day detox
Mhm.
just over a month ago.
Mhm.
I did it with Coach Shaking.
Yes.
She's in our
Yay.
group, yes.
Mhm.
And the first 3 days were horrendous.
Mhm.
The first 3 days I had headaches.
Mhm. Body detoxing.
It was I don't know how I managed the first 3 days, but what
Yes.
Coach Shay said was that if you could make it through the first 3 days,
Mhm.
it gets easy.
Yes.
And I can tell you that after week 1, I felt like I was a different person.
Of course.
Right?
Mhm.
I was clearer in my
Mhm.
mind. I didn't
Mhm.
have that bogginess, that heaviness. I
Mhm.
didn't have aches that
Mhm.
I was having before. I felt overall better from a health perspective.
Mhm.
As a matter of fact, I didn't even have a feel for food.
Mhm.
After week
a
2,
while, yeah.
It was like I don't even want food. So much so that she has reconditioned the palate.
Yes.
And so over the 21 days is a reconditioning of your taste glands.
Yes.
So I would actually recommend that 21-day detox or
Mhm.
7-day detox
Mhm.
to start the reconditioning if you can.
Mhm.
Now there are people who swear by traditional medicine.
Mhm.
There are some people who swear by natural
Mhm.
methods, right? And they don't switch. There are some
Yeah.
people who will do both.
Mhm.
The goal, though,
Complementary.
is to be healthy because
Yes,
women,
what it takes, yeah.
we are the carrier of life. So we bring life.
Mhm.
We are the vessel through which life comes.
Mhm.
Not only do we bring life, we support life once it's here.
Yes.
So we're the nurturers, we're
Mhm.
providers. I mean, I made a post yesterday on Facebook, and people may have thought it was funny because I said my kids think that they call me mom, but they think I'm some kind of miracle working superhero. And I meant that literally because they come to mom for everything.
Yeah.
Mhm.
So as a woman, it's super important for us to take care of ourselves so that we can take care of other people.
And lead by example.
Absolutely, and lead by example.
Mhm.
Yes.
So when you give advice to people, how do you factor in exercise? What impact does exercise have on a patient's emotional, physical, mental well-being?
Exercise is mandatory, I say. And I say that because we talked about chronic diseases. We know that being sedentary is a risk factor,
Yes.
you know. And if you're going to sit down like a couch potato with the remote control, as a matter of fact, with the invention of the remote control, that's when obesity rates kind of soared.
Yes.
Wow.
Because people just
They
sat
weren't
around.
moving.
Yeah, they weren't moving.
I mean, I
So-
actually remember back in the day, to call me from the back room to change the TV channel. That ever happened to you?
The older parents.
Yes, the older
listen
parents.
here.
Yes, we were the remote control.
That's too funny. That's too funny. But certainly we try to keep people moving, particularly with chronic disease. It's part of your lifestyle.
Yes.
Mhm.
Okay. And there are recommendations for exercise if you have chronic disease. If you have diabetes, high blood pressure, we recommend certain minutes of exercise every day. As a matter of fact, some research is now proving that high intensity exercise for a shorter period of time
Mhm.
gives you even a greater result in
Mhm.
terms of keeping you healthier.
Okay.
Mhm.
Okay.
So, ladies, we've talked about diabetes. We've talked about high blood pressure, heart disease. We've talked a little bit about some of those other diseases like sexually transmitted diseases and HIV. So we've touched a number of things that impact women. Now, for us culturally, here in the Bahamas, sex is a taboo subject,
Mhm.
and women don't feel comfortable having a sex conversation with their spouse with their significant other.
Mhm.
So they're not comfortable at saying when they hurt.
Mhm.
They're not comfortable at saying what's unpleasant that they don't enjoy because their thought is on pleasing their partner.
Mm-hmm.
They're not comfortable having sexual conversations with their daughters,
Mm-hmm.
whether they see evidence of them being sexually active or not.
Mhm.
But when we become sexually active, there's a different level of care that's required for our bodies because a lot of things change. Our scents change.
Mm-hmm.
Our genital areas change. We have to take better care of
Mm-hmm.
our genital areas. We have yeast infections.
Right.
We're at risk for other, other infections and
Diseases, yes.
other
Mhm.
challenges.
Mm-hmm.
I remember quite vividly when I first got married, because of my anatomy, my pelvis or pelvic was pointed up.
Mm-hmm.
So whenever we had intercourse, he would up knock that and it would be uncomfortable.
Mm-hmm.
But it wasn't until I had a conversation with my doctor and my doctor said, well, these are the positions that you should
Okay.
try or
Mhm.
use to avoid constant abuse
Mhm.
or constant hitting on that area, because that's an important part of your body.
Right.
What are some of the things that women should talk about as it relates to sexual health with their partners or even with their young children? Because it's a part of our overall health objective as well.
First of all, when you become sexually active, there's some responsibility
Yeah.
that comes with that. And the one thing is everybody's concerned about getting pregnant.
Yes.
Always
Yes,
concerned about the
yes,
young
that's
girl
always-
getting pregnant.
Mm-hmm.
But we're more concerned about sexually transmitted infections,
Yes.
including HIV.
Yes.
Okay, so that's a real conversation that we must have with not only females but also with males.
Yes.
You know,
Mhm.
having responsible sexual activity, which involves contraception, and usually it's contraception that is barrier, or is provided by a barrier method. Okay?
Which would be like a condom.
A condom,
Okay.
exactly, because that's really the only thing that really stops transmission of sexually transmitted infections. Okay. The other thing is, some persons believe that some women believe if they're sexually active that they can't go back to abstinence.
Why?
I don't know, but sometimes you have that conversation with patients too. Yes, you're sexually active, but if you don't want to be sexually active, it's okay. You're a
Stop.
woman, you can stop.
Right.
Yeah.
Right.
Yes.
Right.
Because that's 100%.
So how do we take care of our sexual organs?
Certainly hygiene.
Okay.
Okay, so knowing that you have to clean yourself properly every day.
Mhm.
Okay. The other thing is before and after sexual intercourse, some women, they need to make sure that, particularly for bladder health, you want to make sure that you're not having urinary tract infections. That's the other thing. Also, some people look at their vaginal discharge and they said, oh, I'm having a discharge. And sometimes you can have a discharge that's not really an infection.
Okay.
Okay, it's really just maybe the time of the month that you may have extra cervical mucus or you have extra secretions that are there. If it's not a discharge that has a significant odor to it or a certain characteristic, then it may be okay. Okay, but if you have a discharge, we advise you to have it checked out so that you can know, you can be in touch with what is healthy vaginal discharge and what is not. Okay. The other thing is that you want to we try to encourage women to have a talk with your partner. We encourage that. Have a talk with your partner, talk about some of the likes and dislikes and that sort of thing. And, I'm comfortable with this or I'm not comfortable with that. And that really, that openness and that communication changes a lot of things.
Okay.
Okay.
And Patrice, do you offer in your services or in your products, because I do know that I still can't pronounce them. I took them.
The chaga and the gano, they're medicinal mushrooms.
And what do they treat specifically? Do they help with sexual health or just overall health?
Actually, studies have shown for persons with HIV, and I had one gentleman who kept on herpes.
Okay.
I've had a couple of persons. Now, one of the things I find, because I'm not a medical doctor,
Yes.
we have products, we have services, I have consultants that work along with us. And sometimes not everybody is willing to open up.
Mhm.
So I've had persons who, because they've done their research or they heard me on the radio talking about it, I've had persons, a number of persons with HIV or herpes, and I've gotten some. I had one gentleman. He said he always got outbreaks, and there was nothing that could help. When he started taking the chaga and gano, he called me, and initially he did not tell me why he was taking the jargon gum.
Mhm.
He had me to think something else.
Okay.
And I always get that. And you're after a while you get to the point where you realize, okay, this person isn't telling me everything. They're not comfortable as yet. And then sometimes they come back afterwards and they tell you, especially when they get these great results. And so jargon gano are what scientists call adaptogenic herbs. And adaptogenic herbs, when they go into the body, they create balance. Whatever's too high in the body, it brings it to where it needs to be. Whatever's too low, it brings it up to where it needs to be. And we have persons across the Bahamas for years now. This year makes 3 years, who have been using chaga and gano and have gotten amazing results. We have persons, again, even with sexually transmitted diseases. Now, like I said, everybody does not tell you that aspect of it, but I've had persons come back, one or two brave ones, and share their story. It's also persons who have arthritis issues. We've got lots of testimonies. I have persons who tell me, I run upstairs now. Me who have had arthritis for years, and I'm talking about Grandpa Abaco Nassau. And when I first started and I did the research on it, initially it was for me to understand, because getting older, I don't want to be sick. I'm the first one to tell you, I will run from sickness. I will do what it takes. And when I learned about what they were good for, I began to really do the research. And when I looked at what they were for, and I looked at my country, I'm like, everybody in my country has these issues. And so arthritis, high blood pressure, cholesterol, circulation issues, etc., they have been proven and here to work for so many persons.
Okay, great. So Dr. Holder, my final question for you. A number of people that I've spoken to refuse to see a doctor because they don't want to be put on medication. They may have chronic diseases or other diseases and know that if they go to a doctor will more than likely recommend medication because of what they're balancing or what they're dealing with. If a patient begins with medication, is there a way that they can transition off of medication once they get to a healthier lifestyle, or are they stuck on medication for life?
Like I said, therapy starts with lifestyle changes. Okay, and if you find that patients are controlled, meaning that their chronic diseases are controlled on lifestyle, then they can remain on lifestyle measures, meaning a healthier diet, some physical activity, mental and emotional health, because we're all
one.
Yes, one being. So oftentimes, so I shouldn't say oftentimes, but there are some instances where patients can transition from medication to just really lifestyle changes. And you see that often in patients who might have been overweight or obese, okay, when they were diagnosed. And they put these measures into place, and they lose the weight, and the diseases tend to go away.
Okay, great.
So there's no longer the need for medication in those instances.
So that's great, right? But it's again based on the individual.
Definitely.
Yes.
And the thing is just really empowering patients to look after themselves. You're there with them to go through the journey with them. You make plans together. We negotiate treatment plans. This is what you're going to do. You just need to be accountable to these plans, or to that person, or to yourself, really. Okay, so that you can follow through, and then your health becomes more optimal.
Great. So Patrice, if clients are interested after watching this episode of Empowering Queens TV in reaching you regarding your products and services, how would they go about finding you?
Okay, we have a Facebook page. We have a website, Shaddai Health, SHADDAI Health. or you can give me a call. My number is 439-3242. And if you're in one of the islands, we have distributors throughout the islands in the various stores. But if you don't know, we have it on our website where you can find any of our products in any of the islands.
Are they available for international purchase? Because we do have some international viewers.
Yes. In fact, actually, we get purchases from the U.S., Turks and Caicos.
Okay.
And the only thing is, shipping to the U.S. and the extra cost, people always have to be aware of that.
Okay, great. Thank you so much. And Dr. Holder, how can people reach out to you if they're interested in coming into your family practice?
Well, I'm located on Bethel Avenue. It's number 21 Bethel Avenue in Stapleton. Okay. Also, I'm still an employee for PHA, Public Hospitals Authority, and I do run public health clinics at Agape Family Medicine Clinic.
Okay, great. Okay. So they can just look you up.
Definitely. I'm actually in the local directory.
Okay, great. Mm-hmm. There you have it. Well, thank you, ladies, so much for being here and for participating in this conversation about women's health and about how we can take better care of ourselves through lifestyle changes and incorporating some nutrients and vitamins that actually heal and soothe us, and knowing the fact that we can get assessments on what our current health situation is, and that we can actually make incremental changes to becoming better and healthier individuals. Yes. And thank you so very much for tuning into this episode of Empowering Queens TV with Patrice Lockhart and Dr. Gertrude Holder. We appreciate you paying attention to the information given today, and the power of her platform is designed specifically for you, to help you become more confident and to help you claim what's rightfully yours. Take care, and we'll see you on our next episode. Bye-bye.